presentation, Jim.
Yeah, absolutely. And I remind everyone, if you missed this or you wanted to go back, go to our website, which Sarah and others are working on making it a resource in and of itself. And so this recording will be on our website. But when I was at Away Home Washington, we wrote a report on young people coming out of systems of care. That's foster care, juvenile justice, and behavioral health, residential / inpatient. And back then we found that at that point, this was 2018, 2019. So yeah, I've been pushing this rock uphill for a while. We found that about 70 to 75% of the young people who were homeless within 3 to 12 months coming out of one of those systems of care, 75% or thereabouts were coming out of inpatient treatment. So as a clinician, as someone who's worked with young people, as a dad and uncle and a community member, I've helped a lot of people get into treatment, and to find out that they were being discharged right back to emergency shelters really did impact me. And so we're excited, and we'll talk about it later. But as you know, last year we got 1929 passed that for the first time in this state. And quite frankly, there's probably something, but we haven't found it yet across the country that has housing designed specifically for young people coming out of inpatient treatment. So having said that, that's a transition. We'll spend the first item on this agenda is talking of legislative updates. And if any of you have been tracking it, you know that this has been a sausage making process like no other that I've seen, quite frankly, for so many reasons. One, depending on whose numbers you accept, we have between a 10 and $14 billion deficit. And again, I'm going to talk directly. I'm not trying to disparage anyone here, but just saying it straight up, and it's in the news. But Governor Ferguson has been clear about wanting $100 million for law enforcement and having some other criteria that's important to him, including no wealth tax and ruling out some of the revenue streams. The session is scheduled to end Sunday, so there's lots of bets on whether they go into special session or not. The latest scuttlebutt, and that's all it is that I've heard, is that the chambers, the Senate and the House, do have what they think is a final budget. And now they are still in real time, TVW, passing the revenue streams that would fund that budget. To do an all cuts budget would really be devastating, and Governor Ferguson has agreed with that. The question is how much revenue and which type of revenue do you raise to offset having an all cuts budget? Earlier over the weekend, I believe it was, late last week, they voted down the property tax. So that's not an option. Governor Ferguson made clear he would not support a budget that relied too heavily on the wealth tax. So that's folks who have lots and lots of money. I think it would impact 800 people in the state of Washington, but it is untested in the courts. And so I think there's some wisdom that you can't base your budget on something that you know you're going to be sued on and might lose. And then where's your budget? I believe this is accurate. Some of this changes so fast, so forgive me, but I believe that the Democratic Party in the House and Senate are putting forth a bill that would raise about $100 million on that wealth tax, that same set of families. And so what they're thinking is making it enough money to where they would get sued so that it goes to the courts and we find out if it's legal or not. So not enough that it based the budget on it, but enough to test it out and see if that's a potential revenue source going forward. They did pass, and I got to admit, I fell asleep at about 1:30 in the morning, but I understand, I know that they did pass the B&O tax last night by one vote at about 3:30 in the morning. So there is lots of stress all over Olympia. The latest rumor I've heard is that the budget will be released on Saturday. and they would pass it off the floor on Sunday. And then the political question is, hopefully they're talking to each other, that the governor would not veto it. So hopefully they're presenting him with a budget that he would accept and sign versus veto. Um, I will say this, and again, just not putting a judgment on any of it, but in talking to a Republican that cares about our issues, this individual was saying that their caucus believes that, in fact, they will go to special session, that they will finish on Sunday and immediately go into special session, and all the legislators will go home. And the budget writers from both parties, both chambers and both parties, and the governor's office would then try and hammer out a final budget. So this one will go down to the wire. As it relates to specific items, um, the bridge housing, so we got two houses, 90-day houses passed last session, and we're, thanks to our healthcare authority partners, in process of standing those up, and there'll be some discussion later in this meeting. We advanced a proviso, which a proviso, as you know, is just budget, not a bill, not a law. We already have the law from last year, so this would just be adding to the budget. We tried to get two more of those 90-day houses. And instead, what we got was the funding for the current two houses was in both budgets, the House and the Senate, and it was considered or re-identified, if you will, as ongoing funding. So it's a modest win, but it's a win. The current funding is as safe as anything can be, but we did not get new funding. And I will be honest, given that we're haven't yet stood up the existing funding, it was hard to go in this budget climate and say we need two more when we haven't got the first two up and running. So part of that was also a good faith gesture to our legislative champions. The Bridge Coalition money is in the Senate budget, and we have reason to believe and hope to see it in the final budget. Our House champions have said that they will do what they can to accept the Senate. It's a modest amount of money. It's $200K or something like that. So we think we'll see that. The other priority, at least for NorthStar, was the Homeless Prevention Diversion Fund, flexible funding. Really an exciting program after a year of an average of $2,700 one-time funding. Over 90% of the young people remain in the same housing. And I think the two key features of that program that make it so successful is, hold on to your chair, this is going to be earth-shattering. We actually ask the young people where they can go, where they want to go, where they will be safe. And by them making that initial decision, lo and behold, they actually stay there. So we're hoping to see that. It's administered by the Office of Homeless Youth. It's a $5 million biennial program. There's $4 million in the House and $1 million in the Senate. And so we are hoping, obviously, to see $4 million in the final budget. We're convinced we will have to take a $1 million haircut. But if we could get the $4 million, that would be great. So it's all this thing about what do you focus on? There's so many things that are stressful. I'm reminded of the old quote, don't worry about whether the horse is blind, just load the wagon. I'll give you a minute with that, but just focus on what you can do, man. That's what the challenge is now. So I thank you, those of you who take care of young people and support young people in your daily work. Thank you for that, and that's important. The last bill I'll mention is 1509. This is really exciting. It's a modest price tag. This is Family Reconciliation Services. Some of you will recognize that. Trying to strengthen families, strengthen communities, keep kids out of the system. We had some work over the last couple of years by DCYF, and I thank our DCYF friends, leadership anyway, that supported this, moving away from that in-home counseling being provided by DCYF social workers. I don't have any disparagement about DCYF social workers, but the family I grew up in, the last thing we would, well, my dad probably wouldn't have wanted counseling in general, but certainly wouldn't invite the government to come into our living room and share all our secrets when they're also connected to Child Protective Services. And that's what we heard a lot from other families. So the bill that we have got passed, we're waiting for the governor to sign it. And thank you to Kim Justice and Lori Lipple from Partners for Our Children, and NorthStar played a soft role in it. We got 1509 passed, and it's supporting at about, I believe it's 600K. It is continuing a project in Everett by Cocoon House, which actually has Cocoon House staff members providing the in-home counseling services. And it's been really successful. And so we wanted to keep that alive just as a pilot, because it is, instead of FRS, what you'll hopefully start seeing is community-based dash FRS. Community-based meaning provided, the service is provided by a trusted local nonprofit provider, BIPOC or otherwise, but someone that the community trusts in a way that, again, no disrespect to social workers or government employees. It's just a different thing when they represent the government and say, trust me. So any thoughts or comments? Or I know we've got other folks here who are involved in the legislative process. Anybody want to ask anything or add anything to the conversation around the legislative process? Please don't be shy. Okay, well, again, and I see my friend and colleague Isaac from Office of Homeless Youth. The other item that NorthStar picked up and others have is the prevention dollars, $250,000 for the prevention steering committee that pays lived experts, both family members as well as young people. It's a steering committee that's developing the statewide prevention plan, and Isaac's doing a great job of leading that work. But that money was surprisingly not in the budget, and so some of us have tried to pick that up and get it in there. Again, in other sessions, $250,000 out of a $70 billion budget, might consider that to be budget dust, but not today. I see the chat. I'm sorry. Can you just say what that is instead of this old school fool trying to get to chat in real time?
Yeah, thank you, Jim. Just a quick question. I may have missed it. Because maybe I was worrying about the blind horse, and so I'm just gonna load the. But the question I had was, could you elaborate a little bit on the current funding amounts? Just a little bit. I may have missed what you said related to current funding.
Current funding, meaning the revenue packages?
Yeah, what you said you feel good about, and you talked about not for the next session because I may have missed something there.
Oh, I think I was talking about bridge housing.
Bridge
Yes.
housing, sorry.
Yeah, so what we have in the budget that we hope to see in the final budget is that the current funding for the house on the west side and the east side got identified as ongoing funding and part of the Healthcare Authority's maintenance level budget, which means we won't have to come back next year and fight for it. I think that was kind of already done, but the fact that they put it in statute helps us. What we did not get was new funding for additional 90-day houses or a long-term house, which again, I talked about why that's not a terrible thing, given we're still standing up the new ones. But also, I hope that after the east side and the west side are operational, we might actually have some good data that says, well, maybe you don't need another 90-day program. What you need is a long-term program. So I think there's some, because I think there will always be some young people, and these programs are going to get good at, Jim can live with grandma, but she needs a little bit of extra money to help offset. I think we'll get good at doing that. I also think there will always be some young people who either don't have that easy place to go to, or may want more time in a recovery-oriented environment. And so we might have to create a long-term resource so that we don't create a new cliff that says, oh, we moved the cliff and they're not homeless coming out of inpatient, but now some are homeless even after 90 days and even after extension to 120 days. But I think that's the answer to your question, Paul.
Thank you.
Yeah. So again, last call if anyone has any comments or questions. I will say thank you to the young people who joined me in Olympia. We had 2 days in Olympia where just in the last couple of weeks where we did kind of a second round of advocacy day and met with legislators and reinforced the importance of the bridge and supporting young people who have the courage to go inpatient, making sure they have a soft landing when they get out, and also the Homeless Prevention and Diversion Fund and the Prevention Work Group. So great. Well, we'll move on now. I'm really excited to share or to introduce the folks from the Excelsior Wellness Program in Spokane. I'll let them reintroduce themselves a bit, but I'm just so thrilled. Sarah and I had an opportunity to meet with some of their leadership and Lauren and others, and just really excited about the partnership and what they're going to be able to do with this program. So. Lauren, is it you taking the lead on this? Can I just hand it to you?
Yeah, that's great. I'm Lauren. I did attend one of the coalition meetings, I think two back. I am the Transition Age Youth Administrator at Excelsior. I'm also the VP of Operations. We are excited to get things going. We've been doing some preparation. Met with NorthStar last week. We finalized our contract about a week and a half ago. So timelines are always moving sometimes, but we're still staying on track and focused to get things going. We're really in a program alignment phase and building kind of site preparation, doing some prospective needs purchasing and staff recruitment. And we're looking forward to continuing to meet with NorthStar to implement the guidance and with this group. It's really important to us that we create a program that's meaningful, relevant, and has the most impact for the individuals served. So it's kind of a quick, brief update. I don't know if there's any specific questions about where we're at or thoughts, but I am definitely open to it. We're here to learn, we're here to grow, we're here to bring our expertise and knowledge to the table and be part of this group to have that as well.
Well, maybe you could talk a little bit about your philosophy. One of the things we heard from young people was they wanted, when they got out of inpatient, they wanted an environment that felt kind of homey, not institutional, that's for sure, but also had the expertise and the understanding of, I need medically assisted treatment to deal with what I'm trying to recover from. And so that balance of having skill set and technical expertise with creating an environment that young people actually want to stay at.
Definitely. A lot of, in this like site preparation that we're doing is we do have some transition age youth, not a little bit younger than the 18 to 24 that we're coming into this program, providing some feedback around just even furniture. I mean, just the space about what kind of furniture is available, what could be in the room. And so it's important for us to make it a welcoming, warm environment that's safe, and that starts with the environment and what's in there. I think part of our philosophy is that we want it to be low barrier. We don't want it to have all these hoops you have to jump through just to get to the next step, because we know in some scenarios we have to move quickly to serve people. And so really ensuring that the transition into this program is simple. We get the information that we need, and that we're ready to work with them, whether they're going to be with us for a day, a week, or the full 90 days. It's really about person-centered planning. We really look to the individual to say, how can we show up for you? What does next steps look like for you? And that really guides, again, how we show up and what kind of support we provide. people come to us and will in this program from various different experiences and settings, and we want to acknowledge that, and that's kind of our approach. We don't want to be overly rigid to the point that we're not being responsive to the individuals. We want to be a flexible and growing in that for everybody that comes through our door.
And I just want to add one thing. One of the things that I loved about the site visit and the program is your Excelsior's approach to integrated health and the access points that the young people from this program and all your other programs, because you all have a lot of programs, but that the fact that you can actually provide primary mental health on site, the medication management, you have the ability to do the primary health as well as the behavioral health, as well as the peer support. So I just want to give you all kudos about what that larger vision of integrated health that you've created at Excelsior. I'm really excited to see how that plays out.
Yeah, thank you, Sarah. I mean, it's awesome. Our campus, I think we're on 32 acres. It's a walk across a beautiful kind of lawn area to go to our new primary care clinic. We have a care closet here with food and clothing that anybody can access at any time. We have a disc golf course. We have trail. I mean, we have just this great campus for people to be well, and that might just be having a space to go on a walk. I mean, I love this campus a lot. I think something popped up in the chat. I don't know if that was for me.
Sarah will help us monitor the chat. Lori
Okay,
has a
thanks.
question.
Who has? Oh, Lori,
Thank
yes.
you. Hi, thank you, Lauren. Sounds wonderful. I'm just going back to what I think you said was maybe you will have some young people under 18 in the program. Did I hear that right?
We have two different programs. So we serve transition age youth, and the program that we've ran is called LifePoint, and it's 16 and a half to 21. This is more of a long-term transitional program. We have individuals. It really starts with individuals in extended foster care, but we also serve individuals that are self-referred. From different systems in that program, but it's more of a longer term program that's separate and separate in the building at this time. Yeah.
Yeah, separate programs on the same campus, but
And I was-
aligned
Great.
programs.
And that
So
kind of to one of the
Oh.
questions, sorry, Lori, not to interrupt, but Rachel also from HCA asked what the difference between the two programs were. So that hits that point too, unless you want to expand.
Yeah. Well, it's just the question of under whose auspice is this, with parental consent? Are they dependents of the state? Licensing issues, all that. I just was curious how you were going to be able to make that work, because it sounds fantastic.
Yeah, I'm not sure so the program LifePoint 16 to 21 is a pre-existing program that is on the same campus, but totally separate from the bridge housing, which is 18 to 24, so not needing parental permission.
Got it.
Yeah. But conceivably, somebody could come to the bridge housing if they're 18 or 19 or 20 and say, I want to go into the LifePoint housing. I want to stay in this community. So there's that option for the up to 21-year-olders, is it right, Lauren? Would you agree with that?
Correct. Like if there is a need for, outside of extensions of the 90 days, if somebody's going, I really want to be in this program, I want this continued support, there might be an option for them to join LifePoint. It is a separate program, and I think there's always things that are similar. We call this population transition age youth as well. But I would say that our LifePoint program, we will offer things for them to be involved in, but it's more, there are some treatment, if you will, expectations in that program in terms of like minimum groups attended in a month, or our obligation to provide, specific peer support services or groups. It's a little bit different than I think what the bridge housing program is, and that's really just getting in the door, preventing any homelessness. Like we want them to be, we meet everybody where they're at, but this program I think has I don't want to say barriers. I wish I had a better word, but just less like
Eligibility.
eligibility. Yeah, thank you. That's what for that program.
Yeah. Well, as you might guess, we are just so thrilled to finally get all of this work. And what I love about what we did is the bridge housing is integrated with the Bridge Coalition. So Lauren will be coming and updating. And we're in process, Healthcare Authority is in process of identifying the West Side provider. And so at some point we'll have providers from the East Side, West Side, not only coming here, but hopefully meeting and amongst themselves with NorthStar and really building this network. The overall vision, I remind you, is that we want Washington State to have a lane within the behavioral health system that is culturally and developmentally responsive to young people. That's adolescents through age 24. And particularly resources, inpatient and otherwise, for the 18 to 24-year-olds. Anybody want to ask Lauren a question before we move on, or make a comment? Again, this is if you want to watch, you got to buy a ticket. Please participate. I'll go to MJ and then back to Lori.
Hello, everyone. My name is MJ, and I was just kind of curious on a couple things. What does programming and activities look like? And also, just a question. I heard that people can come and go as they please. So what does that process look like?
So for the first one, we really connect with the community. We want to make sure that they have access to different community events and exposure to those things. So we usually have a big calendar that's like, hey, here's these things going on externally from us that we will support you getting to, or we'll go with you. It's something kind of we would practice. In terms of offerings, we will continue to offer, just like in this space at this campus, groups, different, we have all sorts of support groups that they can attend. So we just want to make sure that there's things available to do instead of just always being in the building, unless somebody just wants to be in the building. We're going to show up however they want us to show up for them. So that's kind of where I start with maybe some programming and offerings for individuals in this program. In terms of access, I think we're still in this startup development phase. One thing that's great about our building is that we have digital badge access at different points around the building that can be tailored to those individuals. So that's something to work through, something to kind of further finalize with NorthStar, as well as having their own bedrooms with their own keys to their own bedrooms.
Good questions, MJ. I think some of that's TBD. I love Excelsior's approach, which is they know how to do this work and they're open to hearing input and ideas and go from there. Lori Lippold.
Nope, that was my question. Thank you.
Oh, there you go. Great minds. Okay, Lauren, anything you want to say or any of you? Oh, Joshua or Sahara, please.
Yeah, sorry. I just had a quick question. I just wanted to know like a little bit more specific about like what kind of practices and programs that they would have there. I was just more curious about that.
Yeah. In terms of the types of groups, I mean, we would do life skills groups, like have those available, mental health groups, mindfulness, and the whole trail of any kind of mental health, behavioral health group. We have SUD service groups that we provide. And then we just have groups of just community connection, that are more about connecting individuals to each other. And hopefully that's not answering your question. If it's more of clinical type things that are available, I would want to bring other stakeholders here to kind of help share. But kind of like what Jim said, like things are still to be determined because we have a lot of collaboration on the horizon, a lot of learning and information gathering, so we can make this an impactful program.
Lauren, I'm going to put you on the spot, but what do you think of you and Sarah hosting kind of just a conversation with some of the young people on this call and part of North, and just hear some ideas from them? And then obviously you guys are the decision makers, but we do want to, and we have a contract to provide TA support, and what I'd really like to center their voice And I assume that's something you're open to.
Of course, we're open to that. And everything that I've shared today is, again, these are ideas generating. I know there's a lot of information and a lot of young people who really, really want their voice in it. What would have helped? What would have been supportive for you? What are we missing? I would be open to that, Sarah, if you are too.
Yeah, absolutely.
Yeah, great. That's how
Um,
much I trust both of you. I knew you'd be open to that. Go ahead, someone else.
yeah, it's John. Hi, Johnny, Ryther, Seattle. Hi, Lauren. Thank you so much. You mentioned low barrier, and you did mention low barrier in regards to access, getting in, but also low barrier is used in a lot of different ways.
Right.
So I'm not actually asking for an answer right now to this, because I don't expect the answer right now to this, but low barrier means a lot of things. And I'm pretty sure that as, these things come together, low barrier for getting in, low barrier for being in the community, low barrier, what it means actually will be super helpful down the road.
Yeah, I mean, again, and they know, Lauren knows this, when we talk to young people, and this was one of the big kind of issues, is low barrier, harm reduction. Young people want a place where the staff and other young people are valuing recovery and getting off of the issues, the drugs, taking my meds, doing the things that help me get well. And so I think that's the kind of milieu. It's not low barrier in, and again, I'm not disparaging anything, but to your point, it can mean anything all the way to I can shoot dope in my bedroom. I just can't come out, can't do it in the living area. I don't think that's what we're talking about. But what I heard her talk about is you don't have to knock to get in your own bedroom. You don't have to find a staff person to go to your own bedroom. These are young adults. So anyway, but I think there'll be some creative stress in that. Go ahead, Lauren.
Well, and I think when I was first bringing that up, I was really talking about the transition from where they're at in inpatient or residential to getting through the door. I agree with you. Low barrier in programming is recovery based and more to come, and how we've really fully developed that. I was mostly speaking to, sometimes there's barriers with paperwork, with transportation, with that coordination too. And so certain elements of that we want to make it, what's needed to get you in the door, kind of low barrier is what I was referencing earlier.
Yeah, it's a great point, Johnny. Okay, any other closing questions or comments? Lauren, anything you want to say before we move on?
Thank you all so much. Thank you for the questions. Look forward to continuing to attend this meeting with everyone.
Great. Thank you. I'll pass it off to Sarah.
Great. I just have to say it's so exciting to actually be at this point where we're talking about the doors almost being opening, hopefully in July, and actually serving young people. Just a full circle moment. So thanks to everybody on this call, Healthcare Authority, Jim, young people. It's really exciting. I'm actually your next presenter, and we are running a little bit late, which I'm glad, because I would rather us talk about young people and Excelsior and the houses as opposed to what I'm going to talk about. But I am on the agenda, so I am going to share my screen. And today, I'm going to have to do this very briefly because I do want to make sure that we share time for providers. But can you all see my screen? Okay, great. So somehow I'm going to give a presentation on the federal policy and funding changes that intersect between behavioral health and homelessness in 10 minutes. So let's just have a quick laugh about that, because as we know, that will not actually be possible. I, like others, really started to kind of dissociate, going between dissociation and doom scrolling on a lot of the federal policy and funding changes. So I decided to kind of take a really broad overview and look at what is actually happening, what's happened, and what is proposed, because ultimately this does connect to the Bridge Coalition and the work that all of us are doing, right? That intersection between homelessness and behavioral health. And what we are facing and are about to face has never happened before in this country. And I just want to make sure that we're all mentally prepared and we know what's coming, which again, I know some of you do and probably are more up to date than I am. But I also want to put a little trigger warning on here, particularly for young people or program providers, really any of us. A lot of what I'm going to be talking about is proposed. And, you know, I want to thank the Bridge Steering Committee and the young people who also gave some ideas for this presentation, but it is proposed cuts. Some of this has not happened. And again, this is a tiny fraction of what's actually going on. So if you are feeling triggered or you're worried about your own personal funding or program, please feel free to not stay for the presentation or ask me questions afterwards, and I'm here to help. So let's just see. Sorry, it's weird presenting and filming at the same time. So brief overview on what happened. Many of us know in March, there was stopgap funding. And so what this means is that the maintenance funding for the government is at around 2023, 2024 levels. And so the federal government, there has to be a bill passed by September 30th for the new fiscal year. So right now, most of the programs I'm going to talk about are funded, but at those levels. So there are, as we also may know, budget negotiations happening right now. There's a lot in the news. There's a lot of information. What we do know is there is going to be much more restrictive cuts to the federal budget and long-term plans. And this includes cabinet level restructuring, the shifting of really large policy and direction in public health and housing, as well as entire new organizations. So it does get really complex. There's a lot going on. And again, I'm only looking at a tiny fraction within a much larger system. We should actually know the reality of what the draft bill is within the next couple weeks, and then fiscal year begins October 1st, but that doesn't actually mean that there will be funding. There may be a very strange limbo period, which I think many of us are concerned about. So for those who don't know, the two organizations, I'm really going to be looking at the cabinet departments as the Human Health and Services, which oversees a lot of the public health, behavioral health. This also includes Medicaid, and then HUD, the Department of Housing and Urban Development, which is a lot of the homelessness prevention, the civil rights and housing. And these are both cabinet level departments, and they report directly to the president. They have their own leadership branches. And there are many of these. These are just two that I'm looking at. This is an overwhelming slide, and I did that on purpose. So HHS actually has 28 different divisions. So again, when we are talking about the complexity of this entire situation, I wanted us all to see, like on paper, how many different agencies and organizations we're talking about under one cabinet position organization. So really, the HHS proposed changes are probably some of the most drastic. You know, RFK, the secretary of this, is making a lot of changes. And so one of them is that they're going to pretty much get rid of a lot of the programs and organizations. So they're merging the 28 divisions into 15 new umbrella agencies. And AHA, the Administration for Healthy America, is just going to be one of them. And so some of the programs and organizations, agencies that are going to be rolled into that include SAMHSA, as well as the Health Resources and Services Administration. AHA, the new program that will oversee a lot of this, has made it really clear that they are looking at chronic disease, environmental health, and food and water as their top priorities. And this really shifts away from public health, housing, and an equity landscape to health. There's 10,000 positions that are going to be cut, and the regional offices will be reduced in half, and the overall HHS budget could decrease by 30%, which is a very large amount. So the risks, I want to look at SAMHSA. Again, all of this is proposed what I'm talking about, but there is 50% staff cuts, and this is greatly going to reduce the functions that SAMHSA has historically provided. Some of the potential programs at risk is the 988 Suicide and Crisis Lifeline, naloxone and distribution of syringe services, peer recovery support services, and a lot of the grant programs for marginalized and underserved communities, as well as the loss of the American Rescue Plan Act, the ARPA, the mental health investments, which HCA could talk about in great detail, and that is currently pending litigation. So that one is currently frozen. I believe that's the latest update. Again, I would refer to HCA, and I have a sources slide at the end. And again, one of the larger philosophical shifts here for the agency is away from harm reduction, away from trauma-informed care and housing first models, more towards an abstinence-based only and mandated and treatment institutionalization. And so this will be a new way of providing services. The next organization that's going to be rolled into the new administration is the Health Resources and Service Administration. And again, these are proposed cuts, but some of the integrated, the federal integrated health centers are at risk. You have the rural access, the telehealth infrastructure that was really implemented during COVID and that started to provide services to people in rural communities who are often underserved and have high overdose statistics. And then the consolidation and the deprioritization of the mental and behavioral health services. And again, really that shift away from health equity and workforce development. So there's a lot at stake here. Next, and this could be an entire presentation for an hour. So again, all of this really could be each organization and division, but the Centers for Medicare and Medicaid, these are proposed, but what is looking like is being proposed is at least an $880 billion cut by 2034. And this really changes the way the federal government and the state governments are able to allocate Medicaid funding. And so you can see here, it's the Federal Medical Assistance Program that could change the government levels of payment towards that. And this could do, 12 states have trigger laws that basically would roll back their Medicaid expansion. And at analysis are looking at 3.6 million people could lose basic coverage to Medicaid. This really creates a crisis to response services, SUD treatment, coverage for youth, pregnant women, and individuals with co-occurring conditions. This could really impact young people who are leaving systems of care, especially if they put work requirements. And it also then directly impacts providers with reimbursement rates, which particularly for residential inpatient and other programs have been historically low. And this could worsen that situation. Next is HUD. So the U.S. Department of Housing and Urban Development. Again, this is a separate cabinet agency. There are 12 different offices. I've listed these here. Now, the thing with HUD is it's deep impacts, but there's not so much of a formal restructure yet that we've been hearing about or that I could find when you're comparing that to HHSS. So it really includes a reduction of funding specifically for homeless services and marginalized communities. So that seems to be one of the overall trends, and at least a 50% workforce cut. So this is really going to put a hamper and a damper in day-to-day operations and just the ability for HUD to continue to provide services. Some of the policy shifts, again, is away from a housing first model. And there are some rumors about a treatment first approach for individuals who are experiencing unsheltered homelessness. And then this is happening, and the elimination of funding for equity-based technical assistance. I put a quote, which again is going to be hard for some people to hear, but the HUD secretary, who's the active one, Scott Turner, said, "Let me be clear, DEI is dead at HUD. We will not provide funding to any program or grantee that does not comply with President Trump's executive orders." And I believe that quote was the same day that they rescinded $4 million in grants to advance DEI programs for those experiencing homelessness. So it's pretty grim. Additional things that are at risk is the Section 8 housing choice vouchers. While there is an increase in funding, a proposed increase, it's still not sufficient to meet with inflation, particularly the economy that we're going to be going into. And analysts are saying that there could be a shortfall of 32,000 vouchers. So this will have a large impact. The emergency housing vouchers, again, this is part of that ARPA funds. And there are over 60,000 vouchers that are set to expire unless it's renewed or replaced. And then there are some grant freezes on the rapid rehousing that could affect the implementation in over 240 jurisdictions, particularly within the continuum of care programs. And there's also just $168 million cut that is being proposed to HUD's homeless assistant grant programs, which supports homelessness prevention, emergency shelters, rapid rehousing, transitional housing, and permanent supportive housing programs. One of the last things that has happened that I also want to bring attention to, now this is a separate agency. This is not under HUD or HHS, but it is the United States Interagency Council on Homelessness. And this was dissolved by an executive order on March 2025. And so it really does end the federal coordination of homelessness. And this organization coordinated policy across 19 different federal agencies. As you see, it develops strategic plans, the Home Together, as well as COC alignment, which really creates a policy fragmentation and less accountability for some of the other agencies within the government to make sure that we are providing equity and prioritizing those experiencing homelessness. Okay, I was able to do this in 10 minutes. So I just wanted to put a quote here. Again, we're not here to change the world, but as I said at the beginning, I do see this coalition and the work that NorthStar Advocates and all of us are doing as changing systems and supporting those that maybe do not have a voice as loud as some of ours. And so never doubt that a small group of committed, thoughtful citizens can change the world. Indeed, it's the only thing that ever has. So I want to thank everybody for your time and the work that you're all doing day in and day out to support individuals in Washington State. It does matter. I know a lot of us have lived experience. The programs being discussed have saved many of our lives, have provided services. And so I don't want to scare anybody, but I do want to make sure that we are looking ahead and how we can collaborate and advocate and create a more responsive system to make sure that those who still need help have access. And here is a long list of sources for those who want to doom scroll and fact check. And with that, I'm going to stop sharing.
There, that was outstanding. That's a lot of complicated information organized in a
10 minutes.
in a way for a C student to comprehend some of it. So
yeah.
Thoughts, comments, anyone want to? Again, this was not meant to depress folks but it is what's happening in the real world. And I've often said, if young people can live it, we ought to be able to talk about it. Yeah, thoughts. And we got Paul and Yvonne on deck who are going to add a lot to this. But before we move in that direction, anyone have anything you want to say or comment on? MJ.
Yeah, I'd just like to say that, recovery services are very helpful and, in getting sober and, finding your North Star and, achieving recovery is a process and it requires peer services. And to see that these programs are kind of, proposed to be cut really kind of cuts the people too, and so it's really hard to see that and to see that, in the future, this could be the new reality when these services are so useful and have been, helping people to succeed in their own lives. Thank you.
Thank you for that. Yeah, there's no doubt it's scary. Well, dire times demand strong leadership, and we've got that all across the state, but here in King County, we really saw it with Friends of Youth and Paul and Yvonne's leadership And Paul, I just by way of introduction, thank you in advance for all the leadership that you've shown since I've been blessed to know you and work with you. But this was on another level. And so if you don't mind talking about first what you did, why you did it, and then what, how the impact or just, yeah, why you did all that. But yeah, Paul and Yvonne from Friends of Youth in King County.
Thank you
Please.
very much, Jim. First of all, just nice to meet all of you, and thank you, NorthStar, for making this possible for us to be here and share a little bit about the impact of the executive order that we started on. I even remember the day. This was January the 27th. This is how unprecedented this was. But I want to say just a little bit about Friends of Youth because some people may not know who Friends of Youth and what we do. So we are a youth serving agency. It goes 0 to 24, and primarily we're known for the work we do related to homelessness and the work we're doing in child welfare, but also work we do in behavioral health. We've been around for about 74 years, so we're not new to a lot of the services we offer, and we're not new to contracts with government, whether it's the federal government, the state government, local government, King County government. So we have a long, good history of doing good work. And I do want to emphasize something that all of us know, but I feel like I know I repeat myself on this often, but I think it's important, especially today and where we are point in time, that, much like all you people who are on this call, at Friends of Youth, we are guided by a simple but powerful truth. Youth homelessness to us is not a personal failure. It's a systemic one. We believe it's a result of inequities that are baked into our institutions: racism, homophobia, transphobia, ageism, ableism, poverty, classism, and a lack of access to behavioral health care. So these aren't just cracks in the system. I think this is a system. So when we made our decision, this is some of the things that we factor as far as what are we doing? And we look at the system and we think that these things, they must be disrupted. So in March, we had to make this very difficult decision to end our contracts with the federal government. This is primarily through Health and Human Services, and I will, if you want to go deeper into it, we have contracts related to with the Administration for Children and Family, and also with ORR. So there's quite a few different things we do, so we have about $5.1 million annually related to contracts we have with the federal government. So it wasn't a very easy decision, and that 5.1 million, by the way, is about 30% of our entire budget. So it was one of those things that we had to look and say, is this the right thing to do? Because again, as I said at Friends of Youth, we're not here to maintain broken systems. We're actually here to challenge them and to disrupt them and to be a lifeline for young people navigating turbulent times. So, as all of you know, whether it's shelter services or homeless youth services, it's just more than just meals and hygiene services. They are trauma-informed and behavioral health supports. They're a trampoline to, if you want to call it, stable housing and an opportunity to hope. And above all, they are community, okay? A space where young people can be themselves, make mistakes, make life-changing decisions, and feel like they belong to something bigger. So these are the things that we are so proud to walk alongside our youth, not ahead of them, as they reclaim their narratives and shape their futures. So all these things were going into us when we first heard about that, that fateful day on January 27th, that they were pausing funding. Now, for those who may not know, federal funding is not funding that, you get a contract or an award, and then, they give you the money up front. It's a reimbursed model. So you do the work, and then they pay you they reimburse you for the expenses that you incurred. So when they did the funding, we were 2 months out. So we had not been paid for November and December. And please remember the folks that we were working with, the clients we were working with, these are legal binding contracts we had with the federal government. And by the way, we've had them for about 25 years. So these are contracts we've always had and have been very secure despite whatever administration it was. So when Jim says unprecedented, it's not unprecedented. I'll just say It is completely bizarre, unique. Okay, so this is something very different. Different governments, regardless of their philosophy or the event, have always recognized that these contracts were legally binding. And until this day on 27th, where they said we're not going to honor a contract. But beyond not honoring the contract or saying we're putting a pause to it, what most people don't realize, we were not also given information or communication as what we would do with the clients that we were serving. I think this is critical because the clients we were serving legally, and this is part of the decision-making process we had to make legally, the clients were wards of the federal government. So even if we wanted to serve them and support them, we could not just take them. They are wards of the federal government. But the federal government is saying, hey, we're going to cut off the resources that you need to take care of them. Okay. So this was very, very, very unprecedented or unique as far as we are concerned. So we kept monitoring the situation, talking to our advocates, whether it's at the state level, the federal level, and trying to figure out what we could do. In the end, we had to make a decision based on business, because we were talking about being down 500,000 for an agency the size of Friends of Youth. We only keep reserves of about 2 or 3 months. So once that reserve is exhausted, you really don't know what you're going to do. So we were worried about what's going to happen. The court orders kept flying back and forth, and the administration kept insisting, no, we are actually going to execute on our plan to do certain things. So we had to really make a decision as far as what was the legal thing to do, what was the business thing to do. And I would say probably the more important thing with our board and key constituent groups, especially our young people, was, what's the moral and ethical thing to do? The programs we were talking about that were funded, we had street outreach programs, we had transition living programs, we had long-term foster care programs. So these are programs that were essential lifelines for the youth, especially experiencing homelessness or those in the foster care system. And like I said, despite our best efforts, especially on communication to try and figure it out, we quickly, the communication we got, at least from our sense, felt like it was, this was new federal policies or guidelines related to being anti-gender, anti-DEI, or anti-immigration. And a lot of these contracts we had were very specific about having those things. So we have ORR contracts, for those who may not know, Office of Refugee Resettlement, and these are about unaccompanied minors. So those are contracts we had that the federal government had endorsed and said, yes, there's going to be these unaccompanied people who are in our country that as their case is being adjudicated, they need to be placed somewhere through different service providers such as Friends of Youth. So when they came back with a new, and I think Sarah spoke to this, the different agencies and what they meant, it just became untenable for us. And we had to make a decision to say, what's the most important thing for Friends of Youth from a mission fit, from a resource efficiency, cost benefit ratio, organizational impact, community impact, and quite frankly, the risk that we will take whatever decision we make. And suffice to say, talking to the board, we made the decision that we would rescind the contracts, which is 5.1 million annually. So we decided we rescinded the contract because we were still mission driven. We were still a values-based organization. And quite frankly, our biggest value is youth first. And we knew that we have been supporting youth and young adults regardless of their situation without judgment. So when 35% of our young people identify as being LGBTQAI, we know that we are their voice. We know that we have to stand up for them and advocate beyond the work we do in prevention and intervention. It is also our responsibility to support them. And going up against the federal government, toe to toe between the small agency and the federal government was just kind of not the thing that we were going to do and feel that we would be successful. So we had to make the decision, what was more important? And we made the decision that, our community, our clients, and quite frankly, even just our employees was more important. Now, there was an impact to it. So it was not just, we made this decision in a vacuum. That we knew there was going to be an impact. As we speak, we had to lay off 41 employees, which is about a third of our employees. We also had to, just giving you a few data points, we make about 200 contacts every year related to street outreach programs. So this is going under bridges, going to 10 cities, going to all these things. And so we are not going to be doing those contacts, or we had to stop those programs. We also had to, deal with the transition living programs which is through RI and the Administration for Children and Families. So some of the contracts we had through there that, took care of about 30 young people every year annually. We also had to deal with the long-term foster care, which was extremely hard because this is a program that we had managed for over 20 years. And quite frankly, the demographic related to long-term foster care was primarily people of color, and I'd be very clear, Latinx. 95% of that identify as Latinx. And we had to tell, not only did we have to tell the foster care parents that we had recruited, some of us who'd been with us 17 years and had serviced, I don't know, to 30, 40 young people over that 17 years. We had to tell all of them that we were not going to continue this program. So it was not just the young people affected, it's also these foster parents who were affected, the young people who were affected. Yvonne, Monique, and I had to talk to them individually. And it was one of the hardest things I know I've had to do in my career at Friends of Youth, is having conversations with a 14-year-old, telling them we're going to discontinue the program, and them worrying about what's going to happen next and asking us very direct questions related to what happens next that we couldn't answer, and yet we were their guardians. So these are some of the things that actually happened. The impact, I would say, in general is, first of all, there's a loss of resources for the agency, but quite frankly, for the community and the sector. So that's a big thing. So that's 5.1 million that has been going towards work being done in our community in King County or in our state that has just gone away. The other thing is, it now puts pressure on all of you, and especially the folks in King County. If we're not doing that work, I'm putting pressure on some of my colleagues, whether it's youth care, whether it's the Y, whether it's New Horizons, because now the shelter work that I can't do, the street outreach I can do, puts pressure on them to do that work. It puts pressure on the county and the regional authority. So it's already a distressed system that we're actually adding more stress to because some of these decisions we've made. But I would just say this, most importantly, there are about 268 people who are affected by this decision. And that's our count of how many people are directly affected. But I think the biggest thing and most important thing that for where we stood is, we've been doing this for 74 years. We know what it takes to do the job. And we've had several different administrations over that 74-year period, that this was not going to be the thing that was going to stop us. We are here to do impact work. We will continue to do impact work. And, it's going to be hard. And we're just going to have to make very tough decisions. But that's kind of the decision we made. And I know I've spoken a lot, so I'm going to stop here and see if there's any questions, Jim.
Yeah, well, all my empathy to you and your staff. I know a lot of your staff, and they're deeply caring people. And so, of course, to the young people and the foster parents, but as they say in the book, not a thing done lightly. I am curious what you've heard back from the feds, if you can share that, and if you've gotten any pushback by other people saying, "What are you doing? You're leaving the mission. You're putting more pressure on us." Kind of the stuff you identified.
Yeah, I'd say
5
that.
minutes left.
Yes, and I'm going to throw it out to Yvonne Wendy here. Just let's say, as far as the Fed was concerned, this was actually very different. So we've always had contract monitors or program directors for the ACF or ORR that we communicated. We communicate on a regular basis whenever something happens. And this was one of the few times where they said, "Hey, don't communicate with us, we will communicate with you. So we didn't even have the forum to have the dialogue to say, here's what's going on. And then finally, we made the decision and we said, okay, we're rescinding our contract. What do we need to do? And I think that's when the communication happened to say, here's kind of some of the things you'll need to do. I'm going to throw it off to you, Vaughn, Monique, to see if there's anything you need to add or answer any question.
I would say that initially, and I just want to say hello to you all and just appreciate all that you're doing as you're navigating these times, either personally and professionally. These are hard things. There were people who really wanted to make sure that we had thought through the decision and we had a lot of data points to speak to. But what I want to also communicate is, meanwhile, executive orders were coming out, right, where we would receive an executive order that no longer in our ORR foster care program could we refer to gender. We could only refer to sex as male and female. So there was other information coming. And as we made the decision, I'm sure that many of you are aware in the news that all of the attorneys were let go. They ended their contract. Office of Refugee Resettlement ended their contract with Kind Attorneys. And so when we made the decision, we did make some predictions based on, just what we were hearing in the system. So the decisions we were making, some of them were things that we predicted would happen. And our worst thoughts came to reality, right? Where there are, 5-year-olds right now showing up in court hearings without any legal representation. Many of the youth were eligible to become unaccompanied refugee minors. And so the good news is that many of our foster families, and a huge shout out to Catholic Community Services, they relicensed foster home after foster home. These foster homes went over to Catholic Community Services to become unaccompanied refugee minor foster homes. So many of the youth got to remain with their families. So we did a lot of imagining best case scenarios of how this could go, and it exceeded. I mean, some of the things we were like, we hope that this will work, right? Trying to stave off ORR saying we need to move these youth as quick as possible, while other organizations were deeply stepping into to doing things so that we could have the best possible outcomes. And we still had the attorneys to work with all of the youth, so they did get the best outcomes for their individual cases. And I say this because many of us on this call are going to be faced with incredibly hard decisions in just like Sarah was saying, in unprecedented times. And we do the best we can to think through all of the pieces while new executive orders or new things are coming out. And in this situation, we made the decision in a timely fashion that these youth were, they did get the best outcomes that we could have imagined, because, within a few weeks, the attorneys were gone, literally gone, right? So they got to work with all of these youth with their cases. And so I just want to say that it was unbelievably hard on April 30th. I'm watching many of my colleagues have to leave. And this is what's asked for, of times where, just as Paul always says, we are friends of all youth, not just some youth. We are friends of all youth, and having to live into that, there is a very real impact to do the right thing because it's the right thing to do. And I'm grateful for that kind of leadership and the thoughtfulness of an entire team that came together. And we tried to think of any other way that we could do this until we came to that decision that we couldn't, that we had to make a choice based on the needs of the young people that we serve. And we made it, and we're living into the consequences of that. And this is what it looks like, right? Is showing up and telling you all that while it's powerful what we did, it's painful. It is incredibly painful.
Yeah, well, I can't thank you enough for coming here and sharing that with the group, adding to this community conversation. Again, I know you. I see Mo as well, who I know is another leader on your team. I just really want to thank you for being willing to come here and share it. I know it's hard for all of you, and so I wish we had more time, but I really thank you both for taking the time to come here.
Yeah, Jim, I just want to say one last thing quickly. 10
Please.
seconds here. No, thank you. First of all, there's a lot of people on the call who, when we made the decision, reached out. And this is what community means. This is what support looks like. when folks in the sector reach out and say, hey, is there anything I can do? I know you reached out, a lot of other people reached out, so I couldn't say thank you enough. And there's a whole ecosystem that you don't think about that are also there. They're supportive. The county was reaching out, our representatives, especially at the federal level. I don't know how many conversations I had with Patty Murray, with Susan Delbene, Kim Schreier, some of those folks, trying to figure out solutions. So there are people who are looking out and they're reaching out to see what they can do. And I just want to say one thing, even as much as we made this decision, we talked about Catholic communities we talked to, they also had to make the painful decision. This is not only 3 weeks ago to say they're going to rescind all their contracts with the federal government. So, and we're talking about 5 million, they're 100 million, that they had to end those whatever, because it was untenable. So they're getting to the same place where mission matters. And I just want to tell everyone else out there, it's hard decisions. I respect anyone and decisions they make. But I think the mission, and quite frankly, the young people we are supposed to serve and who are counting on us, matter so much. Thank you, Jim.
Thank you for that, Paul. Thank you. And it comes across. Sarah, I'll give it back to you. And thank you, Haley, for your patience.
Yeah, I just want to again thank you. I wish we had more time for this meeting. I do want to make sure, Haley, I'm sorry you're not going to have as much time, but I know you can come back and we want you to be back because our next presenter is Pioneer Human Services. And every month we try and do an agency spotlight. So I'm really excited to hear from Haley Joseph, who's the Assistant Director of Clinical Programs, particularly the SUD and co-occurring services. And I look forward to seeing that integration and referral partnership with Excelsior on this side, and just being a part of this community, as Paul and Yvonne and Jim said. Really, that's what we are, right, as a community. So Haley, again, sorry for the condensed time, but I have faith you can do it
Take
well.
the rest of the time, Haley. We'll eliminate the community update. So you have 14 and a half minutes.
All right, I can talk pretty fast. I appreciate you guys so much for having me here today on the call as well. I also have my regional director, Tennille Lightfoot. She may have popped off for another meeting, actually, so it will be just me. And so I wanted to present today. I'm going to go ahead and share my screen. We may not get through all of the slides, but that is okay. We will get through the general pieces of information here. Are you guys able to see that okay?
Yes.
Okay, wonderful. So Spokane Regional Stabilization Center is a treatment center in Spokane, Washington. We're located near the bus depot on Boone Avenue, so 1302 West Gardner. We are an adult program, ages 18 and up, but I wanted to present, just let the call know that, I apologize. We are a available resource for that younger adult population, as well as parents of families who are interested in need of services. So our stabilization center is essentially created as a pre-booking jail alternative. And we have heard there may be some miscommunication or misconception in the community as to eligibility for our program. Even though reducing mass incarceration and working with individuals within the criminal justice system is a large part of what we do, it's important to emphasize that we're also available to anybody at any time in the community that is in need of services with us. So individuals could call us either at 7 o'clock in the morning or 3 o'clock in the morning. 7 a.m., 3 a.m., we're open 24/7 for referrals and admissions. We do take self-referrals, we take behavioral health referrals, we take concerned family member referrals. Anybody can reach out to us and access for services. Essentially, we are Medicaid funded. We also take Kaiser insurance and work really closely with the Spokane ASO for individuals that are Medicare or non-insured. And if anybody has any questions at any time as we go through the pieces, please feel free to reach out and ask questions. So essentially, we are a 3-in-1 program. The services that we provide are mental health crisis stabilization, medically monitored withdrawal management, as well as co-occurring mental health and substance use disorder residential inpatient. With our mental health crisis stabilization program, it is a 16-bed program. Individuals stay with us generally from 3 to 10 days, depending on level of acuity. And the population that we serve in this program is essentially individuals experiencing significant suicidal ideation or potential mental health symptoms that are impeding their daily level of functioning. In this program, each client will meet with our psychiatric ARNP to address their mental health concerns, as well as provide that medical management piece. We also have a staff of mental health professionals here at the facility that are able to work with them for that individual therapy and group therapy component, as well as peer services and case management to help connect them to services out in the community after they are stable within the programming. Before we move on to our withdrawal management program, does anybody have any questions about the stabilization? Okay. Gives me a second to catch my breath.
You can do it.
So our second program is our 3.7 level of care withdrawal management program. So we are a 14-bed program for the withdrawal management, and we do provide that 24/7 nurse monitoring. So we're able to accommodate a higher acuity of medical component for individuals accessing care. We provide medications in-house with our and with prescription from our medical ARNP, which prevents the need for the individuals to go to the hospital prior to accessing services with us. Individuals generally stay between 3 to 5 days, depending on level of acuity, as well as substance use history. They are provided SUDP counseling, group programming, as well as that comprehensive case management and individualized treatment planning. The unique portion of having our mental health stabilization and withdrawal management programs all in under the same roof is if an individual comes to us for mental health crisis stabilization, because we have the diverse disciplines within the building, we can treat both needs consecutively at the same time, not consecutively. Both needs at the same time. So someone's experiencing an active crisis, but say also has fentanyl use history, we're able to assist them in their withdrawal management needs and crisis needs at the same time. Our third program is the 3.5 level of care co-occurring inpatient. So this is our 28-day inpatient. This also has 16 available beds, and the entire facility is co-ed. The way that we're made up, there isn't a certain number of male or female beds. They're very integrated within each other. So it really reduces the barrier for male and females to access treatment. I'm sorry. So essentially we do have substance use disorder group therapy 7 days a week, mental health group therapy 5 days a week, continued ARNP and psych ARNP medication management and monitoring. And we also provide marriage and family therapy services for the individuals in our longer term program to really set our clients up for success and connect them with their families and strengthen those bonds prior to going back into the community. Additional services within the facility are blood and lab testing, STI testing, pregnancy testing, mental health assessments, substance use disorder assessments. We also partner with an outside agency to provide medical education, as well as on a voluntary basis, HIV, Hep C, and syphilis testing. If individuals are interested in the testing, we can provide that in the agency. And Consistent Care, who we partner with, will continue to follow. We'll start treatment in the facility and continue to follow them out into the community to continue that treatment with them. We provide long-acting injectables for mental health and medication-assisted treatment for substance use disorders. We also provide peer bridging and housing specialists that will meet with our individuals in our co-occurring program and connect them with housing services and peer services out in the community. As well as, like I said before, the access to the multidisciplinary team. So whether you're experiencing chronic medical issues, chronic mental health, or chronic substance use disorder, our interdisciplinary team will be able to meet the needs of the individuals in our facility. Peer services and counseling, as well as primary care referrals. So for access for referrals, essentially individuals who are interested in care with us will call us at any time of day or night. We do about a 5-minute phone screening with them, asking just general demographic information and substance use history, and current mental health symptoms to help access that or assess that criteria. After that screening is completed, that individual would be scheduled to come in and meet with our team for admission. This is essentially what our phone screening looks like. We do complete it in an EHR system, so it's a little bit different, but essentially the information that we'd be asking is name, date of birth, insurance questions, as well as substance use history and mental health history down in this portion here. This is just additional referral sources, some client highlights and client feedback that we've received. And looks like I made it in pretty good time with 6 minutes to spare. Does anybody have any questions?
Well, I have the obvious question. First of all, thank you so much. That was great. What are you finding about where the young people 18 to 24 go when they complete any of your programs, but particularly the 28-day or the 5-day? Yeah.
It's essentially, it's client-based. And so we work really closely with them at day of intake throughout the treatment with us to identify the needs or connections that we can make outside in the community, whether that's housing needs, continued treatment needs, outpatient needs. It really depends on the individual's accessing treatment.
But I guess the question is, are you find like part of our hypothesis is that young people are being discharged back to shelters and other rather than kind of a NorthStar or a soft landing. Would you endorse that need is there in the system to have places for young people to go? Or yeah, how do you look at that?
Depending on the need, I would definitely agree that we in Washington State, and I'm sure beyond, there's limited resources for young people and adults alike. And so there are the individuals that do have families that we're able to connect them with, to work with the marriage and family therapy, and they can return home. Some individuals do access other treatment like a 3.1 program or residential, but it really depends on the higher the chronic the need, the more difficult it is to place in that sense.
Yeah, thank you. Sarah?
Oh, I'm just saying that's why I'm so excited to have Haley have you here and learn more about the Bridge Coalition and the housing and connect with Excelsior, who I'm sure you are already well connected with. But yeah, just thank you and good job getting through that so quickly.
Yeah, and I appreciate being able to be on the call today and learn about additional resources as well. I'm definitely taking notes and able to provide that information to our team as well too. So thank you.
Well, I guess my closing comment, we're going to end a couple minutes early, come in under budget. I do want to say thank you to the presenters. Thank you to Sarah and the young people again for all your great work. I really, and this is not just brochure talk or I hope you take care of yourself. It's the old thing about that seems so corny, but the thing they say on the airplane about put your oxygen mask on first. I think we really are living in that situation where we've got to take care of ourselves so that we can be present to others who rely on us. And those are people in your work, but also in your family life and your personal life as well. So, Sarah, you want to say any closing comment?
No, Jim, I think you nailed it. And I just, again, thank the speakers and everybody who showed up and are doing the work.
Yeah. All right, my friends. Be blessed.